to all of our loyal listeners again after about 20 minutes.
Yes, short and sweet in between, but that's okay. We're excited because we have the opportunity to go back to back with two spectacular guests. So we look forward to that. And we're excited to dig into it here. As Conor had mentioned the first time around, we touched on the health pillar while also talking about a few different things. And this time we're going to hit on the housing pillar and a little bit of the positive social network piece, or positive support network. As always, you can find us here on the John Howard Society of PEI YouTube channel, our website, johnhowardsocietyofpei.com, or social media through Facebook. So Logan, thanks for being here, and we'd love for you to introduce yourself and a little bit about what you do.
Cool. Well, thanks so much for having me. I'm stoked to be here in Charlottetown, and so happy to be on this podcast. So my name is Logan. Logan Turner. I am a copywriter with the Canadian Alliance to End Homelessness. So I'm sure your loyal podcast listeners know a fair bit about the Canadian Alliance because you had our senior director, Amanda DeFalco, on a few months ago. But my role with the Alliance is really to tell stories about both the work that communities are doing to really help move people from homelessness into housing, to highlight that work that's happening at the community level that's being really effective. I know across the country in the last 6 years, point in time counts have shown that homelessness has risen, especially or in particular unsheltered homelessness has risen by 300% from 2018 to 2024. Wow. So visibly, we're seeing so much more suffering and homelessness on the streets in our communities in Canada. But while that's happening, communities are doing really good work to build strong homeless response systems, to bring all of the resources in the community together, to build a plan to make sure that we know what it is that each community needs to end homelessness. And I have the really cool job of traveling to some of these communities and talking to these communities and talking to people with lived experience and with living experience, and showing Canadians that every day homelessness is ending for people and that work is moving in the right direction, even when visibly it may not look like it.
Wow,
that's cool.
That is very cool. So where are you based out of, Logan?
I am actually based out of Whitehorse.
Oh, wow. Okay.
Yukon. So just walking outside here in Charlottetown, I was actually warm. It was only minus 12, minus 15 and sunny. I thought that was pretty nice.
It's all relative.
Well, so that was sort of what I was going to say. So obviously, you're based in the territories, you're traveling all over the country. What's some of the most interesting or remote places that you've traveled in this role?
Well, we work mostly. I only started this role in September of 2025, okay. So it's pretty recent, and this has been kind of a new addition to my role in terms of traveling to communities.
Okay.
We are largely working with kind of medium-sized municipalities or regions.
Okay.
But before this, I did work with CBC as a reporter up in Thunder Bay, which is my hometown. And so I traveled and did a number of stories around homelessness and around other kind of systemic racism issues in remote First Nations across northwestern Ontario.
Very, very cool. Very cool. So talking about, as Josh said, this week we're focused on the 5 pillars of the federal framework to reduce recidivism. We talked about health in our last podcast. We're going to talk to you about housing. We're going to talk to you a little bit about positive social networks. The other 2 are education and employment, which will be addressed this week. But let's talk housing. As we had mentioned to our other guest, housing, although all the pillars are connected and they're all important, housing provides just a degree of stability for people that without that base, it's very hard for people to focus on other issues like dealing with substance abuse issues or dealing with mental health. If your life or your day is focused around where am I going to sleep tonight? How am I going to get out of the elements, right? So housing again, such an important pillar, and I'm sure that you've seen that in your work, just the real difference that having that stable base can make for people.
No, 100%. I mean, we think Yeah, I think it's important also like to make a distinction because we're talking about like pillars to reduce recidivism, and when we're talking about housing and homelessness, I think it's important to start just really with distinguishing the fact that like being homeless is not a crime.
Good point.
And I say that because I think we're seeing kind of a wave of policies that are being made kind of at different government levels where homelessness is being, or people who are experiencing homelessness are being criminalized. And I know the Canadian Alliance on Homelessness last year, we issued a statement about one of the executive orders that Donald Trump had issued right at the beginning of his term that really created the conditions in which people could be, criminalized for experiencing homelessness. We had a campaign last year called Homes Not Handcuffs that was talking to, speaking directly to policies that are being considered in, with the Safer Municipalities Act in Ontario. And I think it's important because, Canadians, generally speaking, I think we all agree that everyone deserves a safe place to call home.
Absolutely.
And we know that criminalization does not work. It is not effective. It is cruel. That's not how we treat our neighbors in Canada. And we know that, the solution is not moving people along, but is making sure that people have like a safe and affordable place to call home. So I think like that's on one hand, like that's so important to just like acknowledge off the bat, but also speak to the fact that like we know that homelessness is a challenge that a lot of people in the correction system are experiencing. I'm sure Josh, you will probably have lots to say about that in PEI in particular. But my first experience with that was when I was working as a reporter for CBC in Thunder Bay. I was doing a lot of covering of the correction system right at the outset of the COVID-19 pandemic. And we saw at the time there was huge overcrowding in the Thunder Bay District Jail and Thunder Bay Correctional Center. And not surprisingly, there was an outbreak of COVID-19. That happened in a lot of correctional centers during the pandemic. And shortly afterwards, there was an outbreak that was declared at the local homelessness shelter. And then kind of vaguely, the Thunder Bay Public Health District or unit, they declared an outbreak of COVID-19 amongst, very vaguely, the homeless and precariously housed population. And so that was kind of my first understanding really of that kind of like corrections to homelessness pipeline that exists.
Absolutely. Well, I mean, our numbers here show that about 2/3 of people who are released from our provincial correctional center here are released into homelessness, right? And then that leads to a whole host of other issues, where people, as much as incarceration, we can argue its benefits or not. One thing to say is that you can provide services to an incarcerated population because you know where they are and that's where they're going to be. When people get released, especially if they're released into homelessness, they can fall through the cracks, lose contact with service providers, and then you're back to a whole host of other issues that people fall back into substance use. Health issues can become rampant, as you mentioned. So, having people go say that incarceration to homelessness pipeline, and then sort of maybe the other way, homelessness to incarceration pipeline, has a whole host of problems that come along with it.
Mm-hmm.
But I think it's important to talk about the fact that homelessness is not a crime. It's unfortunately treated like that, especially when it's visible. And we see that, I think, probably most notably with the very public tearing down of tent cities in various municipalities. And that happened with our own kind of tent encampment here a few years ago. And it's like say, it's not the way that we should treat our neighbors, and it doesn't do anything to solve the problem.
No, it quote unquote like cleans up the problem for people who don't want to see it anymore.
Exactly.
Right.
Exactly. Yeah.
And we had Ian from Ordcoat on last year during John Howard Week, and he talked about the intersection between criminal justice and homelessness and some of the stuff that was going on in America and how some of those trends were going to Canada, particularly Ontario. So fortunately, we haven't seen that push here, but it is a scary thing to think about in terms of some of the harsh realities that some of the people who are already struggling with some of these complexities might have to face in the future.
Mm-hmm. But Conor, I think you made like a good point earlier. Like we talk a lot about housing is health, and I think back again when I was working for CBC, I was doing a story about the Indigenous Peoples Court and restorative justice programs that were happening in Thunder Bay, and I was interviewing an elder from Fort William First Nation about at the time he was really involved in one of the restorative justice courts. And, we had a super long conversation. She told me about different cases and kind of how the restorative justice process worked in Thunder Bay. And at the end, I had this kind of realization where I asked her, I said, we talked for the last 30 minutes, but not once did you talk about justice. You talked about health and healing this entire time. And she said, yeah, that's what justice should be. It should be healing. And I know that there's, some like discourse around crime being an ailment, and without kind of getting too much into like, the discussion of whether or not that's appropriate language to be using, if we stick with this like kind of health metaphor in a sense, like housing is health, and there's so much evidence that shows that how like having a safe place to call home creates people to get healthy, just a couple or creates the conditions for people to heal. And I think I was just in St. John's, Newfoundland last week, and I was at one of their supportive housing facilities, and they were telling me that where there's actually a health clinic, a primary health clinic that's embedded within a supportive housing facility. Wow. And they were telling me, about the kind of transformation that people have had in terms of their own both physical and mental health. In one case, there was someone who had their cancer diagnosed at this primary health clinic because they had the time to actually sit back and focus on their own health instead of just be thinking, as you said, kind of like, where's the next place that I'm going to sleep? Where's my next meal going to be?
Yeah. No, absolutely. And, and we've all seen and heard, and I'm never quite sure if it's anecdotal or not, but about sort of, small municipalities, whether in Canada or across the world, that have sort of provided just, barrier-free, no questions asked housing to homeless population. And then you see the significant turnaround that people make. And you see the significant societal benefits too, right? There's less criminal justice involvement. There's less, health can be dealt with in a more proactive manner. So there's less emergency room visits. There's less, ambulance calls and all that kind of stuff, right? So yeah, so housing bleeds into all of these other pillars, right? But it's very difficult almost to focus on the rest of them without sort of housing as that central piece.
Yeah, same way that the pillars themselves are connected, the impact on those other pillars is connected to housing.
Absolutely, yeah.
And the benefits then for those other pillars exist when housing exists and people can get well and deal with some of those other
exactly pillars, right? And similarly, the impact of those other pillars impacts housing, because if people are able to deal with, say, mental health issues, or they're able to deal with substance abuse issues, they become then easier to house, right, for service providers. So the benefit swing go both ways,
for sure,
so to speak.
Yeah.
I actually just like thinking of that. I brought a few examples with stats, because I think just to kind of reinforce what we're saying around how housing is so connected both to improved health outcomes for people, but also improved perceptions of public safety and reduce interactions with the corrections facility. And so, I think about the Dunn Social House program in Toronto, which is something that's had, I think, a fair bit of attention in the media in the last couple of years, or the last year in particular, with the UHN, I think it's the University Health Network in Toronto. Yeah. They provide long-term housing intensive supports for 51 people. And some of their early data shows that there's a 52% decline in emergency hospital visits, a 79% drop in total length of hospital stays.
Wow.
In Calgary, the Pathways to Housing program, they had a 66% decrease in hospital days, a 38% reduction in emergency room visits. And this one I thought was also quite interesting, a 79% drop in what they called jail days for residents that within 1 year of entering that housing program. And so it just I think there are so many examples where when this data is being collected about the impact that housing has both on people's health, but also on reduced interactions with the correction system, it's quite powerful to see.
Absolutely, say 79%. That's a huge drop. And then not that we always want to translate things into dollars and cents, but that seems to be sort of one of the more effective ways to get messages across to people. If you think about, we say a 79% drop in emergency room visits, or 79% drop in average length of hospital stays, if you think about the resources in the very overburdened health system that frees up, that should be a pretty compelling argument to a lot of people that we need to address homelessness, and address it meaningfully.
Well, I think that speaks to how we talk about homelessness being more than just a housing sector issue.
Yeah.
And why, and also the benefit of the other sectors participating and potentially contributing to some of these initiatives and projects and partnering to say, okay, yeah, we'll invest from healthcare or we'll invest from justice, because the return on that investment, which, like you said, maybe not our ideal way to communicate about humans, but our ideal way to get buy-in from people who that's what this on their desk is, the dollar signs and the investment. But to say there is that return on investment within their sector and system if they invest in housing.
Absolutely, yeah. I'd say it's a way to market it politically,
Yes.
perhaps, so to speak, right?
And like in a number of communities that have really dug into this data and taken a look at it, in every situation, having housing, like permanent housing with supports for people, is going to be, like, again, the better option for people, but also the cheaper option. It's going to be cheaper than what it costs for someone to stay at an emergency shelter. It's going to be far cheaper than what it costs for someone to, stay in an emergency room or have, a bed in a hospital. And it's always incredibly so much cheaper than having someone stay in a correctional center, which is always going to be the most expensive option, at least from the data that I have seen in Canada so far.
Absolutely.
Yeah, and so when we had Amanda on, one of the focuses, which is still something that's heavily on our radar, was this idea of trying to improve transitions from institutions into community and sort of improve discharge planning. And whether that's, a proactive approach of getting more upstream and preventative with individuals who are already in the institutions, or whether that's creating clear pathways for them when they come out, or combination of the two. But I think that's something that, we continue to look at as a priority here. And I wonder about kind of your thoughts on that and what you've seen in other communities or other examples.
Mm-hmm. Yeah, definitely. I mean, I would love to know more about what you're doing here in the community, for sure. I know that there are some communities that the Canadian Alliance on Homelessness is working on kind of bridging that gap with discharges, whether that be discharges from the hospital or discharges from corrections, because obviously that's a major source of inflow for people who are entering into homelessness, as they're being pushed out of the facility, or they're being released from the facility with nowhere necessarily to go. And so in the time that I've been with the Canadian Alliance since September, I haven't done any stories yet that have been published around those kind of discharges and bridging that gap. But I was in Niagara a couple months ago in Southern Ontario, and was talking about a project that they have through our Homelessness Reduction Innovation Fund, which is something PEI is quite familiar with.
Yeah,
with 2 projects funded and underway already. But the HRIF project that Niagara is working on right now is really focused on seniors and supporting seniors to find housing before they enter chronic homelessness, so before that 6-month period. And one of the big challenges that they're kind of working through with the local hospital is that when you are working with a population that's much older, their health they're going to have more chronic health conditions that need to be managed, and there's going to be more complex health conditions. And so they're working with the local hospitals kind of through this HRIF project to really make sure that people have sustainable plans for when they are discharged. And I know that's some work that you guys are doing here at PEI with the corrections facility.
Yeah, and that issue with of seniors is one that also pervades the correctional context. The prison population across Canada is aging, whether people are going in at an older age or older inmate, or people are being held until they're quite a bit older before they're released on parole or something. So they have those same kinds of health issues, and there needs to be more mechanisms for kind of compassionate release of elderly or sick or disabled prisoners, because obviously once they reach a certain point, they don't pose much of a public risk anymore. But then again, how do you house and take care of that that population who has these particular specific issues? So again, it all intersects.
Yeah, and I think that also speaks to the lifespan that's going up.
That's true. Yeah.
So people, it wasn't so much of an issue because people wouldn't make it to certain ages
Yeah.
as an incarcerated individual with what would typically be viewed as negative living conditions.
Well, the interesting thing about that is that research has shown that just because of the kind of environment that you're living in when you're in a correctional facility, people age almost 10 years faster in a correctional facility than they do on the outside. So, 50-year-old person in the jail is exhibiting the health and, subsequent health issues that a 60-year-old would normally exhibit. So younger and younger people are aging more rapidly, so to speak, in correctional facilities. So
Right.
you're seeing those issues in a much younger population.
Yeah, and that's probably exponential, that the longer they're in there, then the faster those aging is happening.
Absolutely. Yeah.
And I bet, to bring it back to this conversation, and I don't know what the research is or if it exists, but that same concept applies with homelessness.
Well, there's so one of the really early lessons that the Niagara project, kind of took on is they found that seniors who are entering into homelessness for the very first time in their lives and are going into a shelter, they found, and there's early data suggests that seniors' cognitive decline happens much faster when, like, the moment they enter into a homelessness shelter. And so one of the lessons that Niagara region has kind of implemented already is that they do cognitive assessments or needs assessments with seniors who are experiencing homelessness on a much more frequent basis, because they're finding people's declines in their needs are growing so much more quickly once they enter into homelessness.
Wow.
And again, it's a lot of seniors who are entering into homelessness for the very first time because maybe they lived somewhere for the last 25 years and they had a home that they could afford, and then for whatever reason, whether it was a loss of income, whether it was a family breakdown, maybe it was a rent eviction, seniors are losing their homes, and then they can no longer afford, based off of their income, what they were paying just before that, because they may have been paying $800 a month for the last 10, 15 years, and I don't know where you're going to find a place for $800 dollars a month now once you're evicted. And so anyways, yeah, so very much connected to seniors like experiencing homelessness as well.
Yeah. And I'd like to kind of move the conversation a little bit to talk a little bit about this idea of like positive support or positive social networks. I think a lot of people, particularly those who are involved in the justice system, don't always have the most positive peer support networks. There could be groups that reinforce substance use or criminal behavior. And I know, Josh, it's something we've seen sometimes. We get good clients eligible for housing, we get them housed, but then the friends start showing up, right? And they're taking advantage of the fact that this person has a house and a place to live, causing issues, and then the person gets evicted. Right. So aside from, issues of, positive support networks, or the lack thereof leading to recidivism of people getting involved with and sort of criminally involved, a lack of a positive social network can also lead to issues with housing as well.
Right.
And so the importance of establishing, positive support networks and cutting ties maybe with the negative networks and developing new social networks. And so, Logan, have you had any experience or seen any of that go on in your role?
Certainly, yeah. I think when it comes to talking about positive support networks, specifically for housing, I'm thinking a lot about the housing support workers that I've met kind of along the way and that have been really key people in the stories that we've told around what's an effective response to supporting someone from homelessness into housing. And so I'm just thinking, there was one support worker. I'll go back to Niagara just because I think I spent a fair bit of time there in early January. But she was telling me about, she should be here really telling the stories because she, works with seniors every single day to help them find a place to call home. But she was telling me about the kinds of situations that people find themselves in, where she had one client who was being moved from one apartment to another. And so they were moved there, and then they were left outside of this apartment without any contact with the new landlord and without a key to get in. And so they had no idea how to get into their place. So they called this one outreach worker, kind of in a panic. And she was there to make sure that that the transition happened in the first place. Otherwise, who knows what could have happened to that
Absolutely.
individual. And a couple of the seniors that were helped in particular by this team in Niagara, they sent in some of their experiences just like in writing, what it was like, the importance of having that support network, or having that support person in place. And in one case, someone called this group of housing support workers a group of angels, who were sent to help them navigate getting back on their feet. They said that they made us feel like we mattered and that our well-being was important. And so I just think, like, in all of these situations where people are finding themselves homeless, or they're finding themselves in the most difficult period of their lives, trying to navigate through complex systems that they have never had to navigate before, having someone in your corner to back you up and to put you on the right track to getting back to the place you need to go. It's so important, and you guys can speak to this much better in terms of those positive support networks, in terms of the correction system, because I can't imagine what that would be like, being discharged from an institution where you've spent maybe 3-6 months, a year or longer, and you maybe have court-ordered restrictions that mean you can't talk to the people who you have talked to before. Maybe you don't have ID anymore, you don't have a place to go, and just trying to navigate those things in and of itself. I can't imagine what it would be like without having that person that's there to support you.
Absolutely. And you talk about that too, and this is something that we provide with our services here, Jeff. You talk about this idea that if someone's been chronically homeless for a long period of time, or incarcerated for a long period of time, or even if they come from like generational homelessness, they may not know how to do things like that we kind of take for granted, like budgeting to pay your rent and your bills and your groceries,
laundry,
or
cooking.
keeping your place clean and all that kind of stuff, right? And so important to have someone to teach those skills, but also to kind of serve as a little bit of an intermediary with landlords, right? Where for a landlord might come in and be like, you have to leave this place a mess, to have them be like, what, don't worry, we'll take care of it. We'll make sure that they know what to do and don't do that again, right? So
I think that speaks in general to this idea of like case management services.
Yeah.
Right. And one of the things that is well established now with the research, and we've continued to see in the PIC count survey data, is that most individuals not only need but recognize they need some level of support along with housing.
Yeah.
And I think historically there was a time when you could just give somebody a place to live, and they could function within that. But the complexity of the individuals that we're working with has since surpassed that.
Yeah.
And now, like you're saying, whether it's a designated support worker for housing, whether it's a dedicated support worker for justice, whether it's somebody that, like most of our staff, does a bit of everything, people need somebody to help them navigate and deal with some of the challenges that they face.
Mm-hmm. It just makes me think also of another story I heard. I swim in stories is basically which I love. But I was talking to a social worker who's involved in supporting people in finding housing, and she talked a lot about, or she talked about one client in particular, who has been reestablishing, or they've been learning through their work with the social worker, how to establish good boundaries, safe boundaries, because they had a house at one point, and they had some friends that were not great influences that they got into some stuff that caused some trouble and led to an eviction. And so a big part of their work is now helping this person who is living more or less independently with some supports, kind of identify how to establish those barriers or those boundaries, to make it a safe living place for them, to make sure that they also don't fall back into a situation where they're evicted or where they're going to become homeless. And then she said, that she's found some really lovely situations where a father has built good relations for his daughter, and was having her over for dinner, and that was maybe a relationship that previously was quite challenging, and that challenged that housing situation. And so, just again, speaking of that importance of having that positive support network, also recognizing that it's not necessarily needs to be there forever. At a certain point, people just need kind of the help to be pushed into the right direction. around having those skills to, maybe it is, boundary setting. And once they have those skills, then they'll be able to continue forward.
Yeah, I think of it like sort of like a support network and a social network, and say like maybe initially you need more of that support network. Say teach you to do things like set those boundaries, but then once you're able to do that, you're able to establish a bit more of a positive social network. And once you have that, you need that support network a little bit less.
Yeah, that's sort of that transition towards independence.
Yeah.
Piece. That in the beginning, like you said, somebody needs to be there to kind of model and teach, and then can pull back a little bit over time.
But it's like, it's like you said, right? And I think your story, Logan, exemplified it perfectly. When you have the negative influences around you, it can lead to evictions. It can lead to criminalization. When you have that positive support or positive social networks and boundaries, it can lead to success, huge success.
Yeah, reintegration with family and reconnections.
Mm-hmm.
Yeah, and it's challenging for folks because they have a history with some of the people that they've experienced homelessness with or experienced corrections with, and there does become like this social debt piece where people feel like, well, you helped me when I needed this, so now I have to help you, or I don't want to see you out homeless because I know what that's like. And so there becomes almost this unwritten rule or code of like needing to help one another and stick together in these things, even though it can jeopardize housing.
Yeah. And I think, and that's a laudable thing, right? But I think it comes down to those healthy boundaries, right?
Yeah.
And being like, you know what, I'll help you, but okay, you're overstepping, or you're doing this, or you're becoming a detriment to me. So at this point, I can't help you anymore, or I can only help you this far, right?
Yeah.
Just a matter of being able to recognize and establish, who's positive, and who can I be a positive supporter, positive social network for, and who's going to be detrimental and kind of bring me down with them, right? So.
Yeah, and how to navigate, I think, like staying within those boundaries and still being helpful. Like this conversation makes me think of another woman I spoke to in Southwestern Ontario who, had been chronically homeless for up to 3 years, living outside in a tent, kind of moving around, the region. And she was able to successfully find a safe place, a safe, affordable place to go home. It's a little bit outside of the city center. She's a little bit worried, about those connections with people that she spent a lot of time when she was homeless with, and about how that might affect her substance use, which she feels like she's really recovered from. But she was telling me, she knits hats and mitts on a weekly basis for people who are living outside, because she knows exactly how it feels to have to be cold outside, living outside. And so that's one way she feels like she's giving back to the community of people who were that network around her for a long time, while still maintaining that healthy boundary.
Nice.
That's super
Very
cool.
nice. Mm-hmm. Yeah. That's a perfect example.
Mm-hmm. Yeah. In terms of kind of the connection here between housing and positive support network and criminal justice, I wonder if there's any other kind of insights around stories or anything else you had that you wanted to kind of share on this topic.
I think just maybe what I'll speak to is the power of storytelling. I think that, when we talk about people who are experiencing homelessness, or people who are incarcerated, or people who are both, in a correctional institution or a correctional center and facing chronic homelessness, is that these people face a lot of stigma, and there's a lot of stereotype. And you guys, I'm sure you guys talk about this a lot on the podcast. And it's something I think that everyone is working towards. And I think what I'll just say is that the power of storytelling is able to crack through that stigma and to break apart those stereotypes that exist, because it allows us to connect with the humanity of people who are experiencing these really horrible moments in their lives, and to help us understand what it is as society, as a community, we can do to come together to help create conditions that mean that people don't fall into these really difficult places.
Yeah. And I think in that is a perfect kind of companion to the end of our last podcast, which is that we need to focus on the fact that the populations and the people we're talking about are people first, and homeless or mentally unwell or addicted, I mean, maybe not even second, but later. But they are human beings first and foremost, right? And that's the thing that we all need to keep in mind, and that I think too many people unfortunately forget too often.
Yeah, they start to view people through the lens of their challenges.
Exactly.
And as you said on the last podcast, I certainly wouldn't want to be judged based on the worst things I've done or the worst days I've had.
Exactly. Yeah.
Well, Logan, I appreciate you coming on and spending some time with us as we move towards kind of the end of our time here. Is there any other insights or anything else you wanted to share for us?
I think there is one story, that I think I wanted to come back to, just because it's something that Conor, you mentioned around the importance of housing and how that leads to like reduced interactions with the correction system. And one story, that I often refer to, it's a community that we work with quite closely with the Canadian Alliance to End Homelessness, is in St. Thomas, where they put up a few years ago a supportive housing unit for people experiencing homelessness. It came with the 24-hour support that some people need. And a police officer kind of was looking at the data shortly after this supportive housing unit was created. It was built right in the downtown core of St. Thomas. And the police found that calls for service in the downtown core dropped more than 80% after a 15-bed supportive housing unit opened in the area. And I think that's something, that's something that's really important to highlight, because across the country, we see there's a lot of initiative, there's a lot of movement towards building more supportive housing that we need in communities, so people have both a safe, affordable place to call home and a support setting to maintain their housing and to be healthy. There's a lot of pushback from the community talking about, saying, we don't want this in our neighborhood. And there's, a part of that is understandable, where there's something new that's coming to a community where people feel quite safe and they know their neighborhood, and there's this new element of the unknown that's a bit scary. But I think telling stories also about the way that housing helps reduce both perceptions or improves perceptions of public safety and reduces interactions between people and the correctional system or the police system is really important to also kind of address some of those fears, some of that NIMBYism we're seeing kind of rise up as we're trying to push more supportive housing forward.
Absolutely.
Yeah, no, that's a great point around, the positive impact that having a supportive housing site or having a site that helps people can have around that area. Because there are people that probably drop in there and get some unofficial support, even though they're not clients of that spot, but now there's a little bit of a hub for people. And that creates some spaces for people to go. Anything else you wanted to add here, Conor, before we move to wrapping up?
No, I think that's everything.
All right. Well, Logan, thanks for coming on and talking with us. We appreciate your ability to share some stories. I think, like you said, this is really neat that you get a chance to travel around to communities and give clients a voice. As Conor said, it's important to not only humanize them, but then, like you're adding, give them that voice for them to be able to say, hey, this worked for me and this is why, and this is what I need. And so I think that's really important work and really great work. So thank you again for joining us, and we appreciate you taking the time, and hopefully you enjoy your stay here in PEI.
Awesome. Thank you so much. Looking forward to telling some more stories out of PEI.
Thank you very much, and enjoy the, I guess to you, beautiful weather.
All right. Well, thank you, everybody. We'll be back again tomorrow with another great guest. Until then, you can continue to find these podcasts on the John Howard Society of PEI YouTube channel, website, or social media. Thanks again for listening, and take care.